I appreciate those words. Thank you. Thank you, Mr. Chairman, for holding today's hearing. Just in listening, it's just shocking that right here in the United States, women are dying from preventable pregnancy-related complications. That alone is shocking, but that women are more likely to die from those complications here than in other parts of the developed world, that's shocking. And the fact that this risk is 3 to 4 times higher for black women than white women, that's shocking. So it's a tragedy and it's an emergency, and thank you, Mr. Johnson, for sharing your story with us. I want to thank my colleagues, Congresswoman Herrera-Butler and Congresswoman Gett, for introducing the Preventing Maternal Death Act legislation, which I'm a proud co-sponsor of, and I hope that after today, our committee can move forward on solutions to this problem that we really need to move quicker. It is more quickly. It is a long past time we acted to reverse this horrible trend once and for all. So let me ask this question. I've long supported investments in family planning and reproductive health, and I'm particularly interested in the impact that such investments can have on maternal mortality. As the ranking member of the House Foreign Affairs Committee, I've seen that impact on a global scale. In fiscal year 2016 alone, U.S. investments in family planning worldwide provided contraceptive services and supplies to 27 million women and couples, which in turn helped to prevent 11,000 maternal deaths. So let me ask Drs. Correa-Perry and Coslett-Charlton, would you each explain why meeting unmet need for contraception helps to prevent maternal deaths?
So there's been some data that shows that the safety and security you get from having access to family planning and not having to worry about if you're going to get pregnant again because you're not planning to be pregnant at that moment really decreases your stress and your weathering and ensures that you have a healthier pregnancy. We know that we've looked at the states that have more supportive policies around family planning also have better infant mortality rates and better maternal mortality rates. So it's not a coincidence that when you invest in family planning and when you invest in infrastructure for moms and babies, you actually create a safety net where people can live longer and be healthier. So it's important that these policies that are created in this House improve the ability for moms and babies to live.
And I would certainly echo that response, but also it's been shown that women that are able to plan their pregnancies by spacing interval between pregnancies and having access to adequate contraception, that it improves the safety. There's very clear data to show that it improves outcomes in pregnancy and delivery also.
So thank you. Along those lines, let me ask if either one of you would explain why women in the United States specifically have unmet need for contraception. By that I mean they want to use modern contraception but are not currently.
So because it's a state and local issue usually around access to family planning and reproduction, and because when we allow that to be made state-based wide, people's you get gaps in what states pay for things like sex education, what states allow for things like having birth control inside of high schools. Once again, I'll say for my great state of Louisiana, we struggle with getting sex education into schools. We struggle with getting access to family planning for the people who actually need it very desperately. So I think in the attempt to make for a safe environment for our state, sometimes we mislabel what safety looks like. Safety looks like having access to choice when it comes to your reproduction. And when you have that access to choice and information, you can have a safer pregnancy and a safer outcome.
Well, thank you. Obviously, there's a lot more work to do on this front. Let me mention this. A December report from the Guttmacher Institute estimated that globally, and I quote, fully meeting the unmet need for modern contraception would result in an estimated 76,000 fewer maternal deaths each year. That's 76,000. So I want to ask either one of you doctors to please, if you agree, is it fair to say that improving access to contraception for American women could help address the rates of maternal death in the United States?
Yes.
That's a loaded question, but I wanted to put it out on the record. I wanted to also take this opportunity to briefly talk about legislation I've introduced with Congressman Stivers, the Quality Care for Moms and Babies Act. The legislation would bring together diverse stakeholders to identify care quality benchmarks for women and children in Medicaid and CHIP, as well as fund new and existing maternity and infant care quality collaboratives These collaboratives bring together local stakeholders, such as doctors and nurse midwives, to share the best practices and improve care for patients. And I'm grateful to both the ACOG and March of Dimes for supporting this legislation. And let me ask you, finally, let me ask maybe perhaps Ms. Stewart, I'll ask you this. Wouldn't you agree that we should be measuring and evaluating the performances of Medicaid and CHIP in caring for America's moms and babies, as well as investing in prenatal quality collaboratives which work to implement maternal mortality review committee recommendations at the state level?
Congressman, we're very involved across the country in perinatal collaboratives, and they are very effective, and we very much support them. And I would just add this point, which is that 60% of all births are covered by Medicaid. And that's a lot of women and a lot of babies. And whatever we can do to make sure that the quality of care exists for those women as it does for women in the private insurance market, to make sure that we're collecting the kind of data to understand what is effective and what is not, and that we're sharing that data across states, we would firmly support that.
Thank you. Thank you very much. Thanks, Mr. Chairman.